And in the wake of research and development as the world races to evaluate the safety and efficacy of drugs and drug combinations against COVID-19, Dr. Mary Stephen, a technical officer with the Health Emergencies Team, the World Health Organization Regional Office for Africa, Congo-Brazzaville, joins us now via Skype. We'd like to thank you, Doctor, for joining us on the program.
Thank you. Good evening. Thank you for having me.
I'd like to begin with less than 6 months into this emergency response to COVID-19 on the African continent. What's your assessment as to how countries have responded so far?
For Africa, as you can see, the situation is still evolving. We haven't seen the peak of the outbreak yet on the continent, but Africa is the continent that is reporting the least number of cases. So we have like 115,000 cases, over 3,000 deaths, and over 45,000 recoveries from all the 55 countries in Africa. So, but Africa has implemented early action, and this has helped to slow the progression of the outbreak on the continent. So if you look at the predictions previously made and the situation currently in Africa, it's more than 3 months now. And the cases are still very, very few. So this is as a result of the action taken early on during the outbreak on the continent. But of course, the situation varies from country to country. We still have countries that have less than 100 cases, and of course, countries that are reporting high number of cases. And the large proportion of these cases are coming from about 5 to 6 countries, including Nigeria.
Dr. Stephen, let's look at the race for a vaccine. We've seen some discharged patients in Nigeria, notable political leaders as well, confirm the efficacy, if you will, of hydroxychloroquine in treatment of COVID-19. But with the WHO suspension of trial, should treatment with the drug be on hold?
Yes, so in March 2020, WHO launched the Solidarity Trial for COVID-19, and this involves 4 treatment regimens. So one of the treatment is remdesivir, one of the drugs that was discovered and being used for Ebola treatment in DRC. The second treatment is lopinavir, ritonavir, which is HIV drug already being used for HIV treatment. And a third combination is lopinavir, ritonavir, and interferon, also a HIV treatment. And then we have the chloroquine and hydroxychloroquine. So these 4 regimens were being used as part of the Solidarity Trial. So over 100 countries have indicated interest. In Africa, we have about 31 countries that have indicated interest, but so far countries in Africa have not started officially enrolling patients. We have over 400 hospitals with about 3,500 patients in over 17 countries globally being enrolled in the Solidarity Trial. So following evidence on the issue of safety with regards to hydroxychloroquine, there has been a review, and then the drug has been placed on temporary suspension. So basically, the reason for the trial is to determine the quality, safety, and efficacy of these drugs as it regards to COVID-19. Yes, we know they are being used for other disease conditions, but they have not been tried before for COVID-19, and this was the reason for the Solidarity Trial. And of course, if you're doing a trial, any drug that tends to be gives more side effects than benefit to the patient, definitely it will be suspended until further analysis has been done of the data on the safety.
All right. Last week, the UN issued a policy brief outlining the impact of the pandemic in Africa. It insisted that, countries on the continent, like everyone everywhere, should have quick, equal, affordable access to any eventual vaccine and treatment. But a lot of people wondered if there was a threat in the first place that perhaps Africa would be the last place to get the vaccine.
Okay, there has been discussion at global level on equity for potential vaccine that might be discovered, and so Africa will also benefit from any vaccine that is discovered for COVID-19 as much as any people from other parts of the world. So there has been a lot of research ongoing, but unfortunately on the continent there is no single research in terms of the use of vaccine for COVID-19. But when this vaccine is discovered, we know that WHO is working to ensure equity in terms of distribution of these vaccines to all the countries of the world, including Africa.
All right, Dr. Mary Stephen, we appreciate your time on the program. Many thanks. As the technical officer with the Health Emergencies Team, the World Health Organization, Congo-Brazzaville. Thank you for joining us.
Thank you.